My name is Shane Murphy,
My name is Manisha Manhas.
and we are both graduates of the Mayo Family Medicine program. I graduated in 2018.
And I graduated in 2019.
I went on to do a palliative care fellowship also at Mayo Clinic. And at the end of 2019, we both returned to British Columbia, Canada, to Vancouver, to practice a combination of family medicine and full-time palliative care. I also have been working with the University of British Columbia. I was lucky enough to get a faculty position with them, and I'm working with residents, fellows, and medical students, both on-site at the hospital and with some lecturing as well.
I wasn't too far into my first year of practice when the whole pandemic started, so we quickly switched to telemedicine in first year of practice. And it had its challenges, but I think that having your own panel while you're at Mayo, being able to manage them for a large part over the portal and online already, that really helped kind of smooth that transition.
I think what attracted me to Mayo Clinic is that one distinct memory I have of being at the AAFP conference in Kansas City, walking up to the Mayo Clinic booth. And I think when you think of a big institution like that, you maybe think that a little clinical, maybe a little cold, maybe a little, too big for niceties. But I just remember somehow I was the only person there for about 5 minutes, and just having a program director, a chief resident, and about 5 residents all just kind of descend upon me as I came up. And that just came from a place of them being genuinely good people. They didn't know me from anyone, but they just came up and were full of life, full of fun. And that continued on. I went to interview there, and I just loved the people. I loved the people out of Kasson. And I could see that there was some people there that could really mentor me and coach me. And so that was it. I think it was really the people that attracted me there.
My favorite memory at Mayo, I always really liked the casting seminars that we would do. That was always fun because we all got to do it together.
Mm-hmm.
All resident seminars that we did once a month were really fun. Resident retreats every year, that were really good too. It was a time where you got to hang out with all 3 years, and it wasn't a work day. It was outside of work. You could hang, catch up, do some fun activity. I think that people are a big part of what I think about fondly when I think about the program. Our faculty, our residents, in all 3 years, I think. Other highlights, it's when I first started, I don't think the hospital service was my favorite rotation, but by the end of it, I just loved it.
Mm-hmm.
And even though I'm practicing community medicine now, I think that's still always going to be a highlight of the program for me. Getting to work at Mayo, at the hospital, at the downtown campus, but also getting the opportunity to come out to Kasson. Totally different settings, but all part of the same program.
I think when you start, particularly family medicine residency, most people still are thinking like really broad and that they might do a little bit of everything. And to be fair, I think Mayo gets it really right. They don't overdo it in any one area, but they give you a really, really good foundation in every area of family practice early on, and then allow you to taper it as you go through or more to focus on the areas that you really like. So if you want a world-class experience in any area of family medicine, be it your hospital as service where you really see plenty of bread and butter stuff, some complex stuff, and then have great access to subspecialty input as well and teaching. I think that's one thing. I think the other thing was the mentorship as well.
Mm-hmm.
So, I really felt like there was a few people who were really invested in my education way beyond what I'd ever experienced previously. I think it was, I assume it's unique because I just haven't experienced it before, and it was quite incredible to have people who really cared about getting you from A to B and all the wayward points you took in between. So,
yeah.
So that was incredible.